Did you wake up one morning with sharp back pain so intense you could barely bend, sit, or stand? If that sounds familiar, you might be dealing with a slipped disc, and ignoring it could make things much worse. But here's the good news. Most people don't need surgery, expensive treatments, or strong painkillers to recover. In today's video, I'll show you simple, doctor-approved exercises and recovery tips you can do right at home to reduce pain. Protect your spine and get your life back. First, what exactly is a slipped disc? Your spine is made of stacked bones called vertebrae, and between each one is a soft, cushiony disc that acts like a shock absorber. Slipped disc, also called a herniated or bulging disc, happens when one of these cushions shifts out of its normal position. When this disc bulges or ruptures, it can press on nearby nerves. This pressure is what causes the pain, numbness, or weakness you might be feeling. The symptoms can vary quite a bit from person to person, but there are some common signs to watch out for. Many people experience a persistent, nagging pain in their lower back. You might also feel a tingling sensation or numbness that travels down into your legs. Some people notice muscle weakness, making it difficult to lift your foot or stand on your toes. One of the most classic symptoms is a sharp, shooting pain that runs down one leg, which you might know as sciatica. In more serious cases, a slipped disc can interfere with basic movements like walking, standing, or even just getting through your day. So why is it so important to take action early? Well, ignoring a slipped disc can lead to bigger problems down the road, like long-term nerve damage and chronic pain that just won't go away. The sooner you address it, the better your chances are of healing naturally and fully. The great news is that the vast majority of slipped discs get better with non-invasive care. This means that with the right movements, better posture, and a few lifestyle changes, you can often find significant relief without needing drastic measures. And a quick reminder, if you're finding this information helpful, please take a moment to like the video, subscribe to our channel, and turn on notifications. That way you won't miss out on more trusted health and wellness tips designed to help you feel your best. Now let's talk about what you should absolutely avoid while you're recovering. Protecting your spine is your #1 priority. First, avoid any heavy lifting. This puts immense strain on your lower back and can make the herniation worse. Second, steer clear of sudden twisting movements. Quick, sharp turns can aggravate the sensitive nerves around your spine. And third, and this is a big one for many of us, limit prolonged sitting. When you sit for too long, especially with poor posture, you're putting a lot of extra pressure on your lower back discs, which can slow down the healing process. If you have a desk job or have to sit for long periods, make it a rule to stand up, stretch, and take a short walk every 30 to 45 minutes. So what should you be doing instead? It's a common misconception that you need complete bed rest. In reality, that can make you stiffer and prolong your recovery. Gentle movement is your friend. It improves blood flow to the injured area, reduces stiffness, and helps speed up healing. Focus on light activities like walking at a comfortable pace. Pay close attention to maintaining good posture, whether you're standing, walking, or sitting. And don't forget to stay hydrated. Drinking plenty of water is crucial for keeping your spinal discs plump and flexible. All right, let's get into the most important part. 5 safe and effective exercises you can do at home to relieve slipped disc pain. Remember to listen to your body and stop if you feel any sharp pain. First up is the pelvic tilt. This is a very gentle exercise that helps activate your core muscles and stabilize your lower back. Lie on your back with your knees bent and your feet flat on the floor, without lifting your hips. Tighten your abdominal muscles and gently press your lower back into the floor, flattening the natural curve. Hold this for a few seconds, feeling the engagement in your core, and then relax. Repeat this 10 to 15 times. Next, we have the knee to chest stretch. This helps to gently stretch the lower back and glute muscles. While still lying on your back, gently bring one knee toward your chest, holding it with your hands. Keep the other leg relaxed on the floor. You should feel a comfortable stretch in your lower back and hip. Hold for about 20 to 30 seconds, then slowly lower your leg and switch sides. Do this 2 to 3 times for each leg. Our third exercise is the cobra stretch, also known as a prone press-up. This is an extension exercise that can help guide the disc material away from the nerve. Lie on your stomach with your hands placed under your shoulders, like you're about to do a push-up. Keeping your hips and legs relaxed on the floor, slowly press your upper body upward. Only go as high as you comfortably can without pain. Hold for 10 to 15 seconds, then gently lower yourself down. Repeat this 5 to 10 times. Fourth is the cat-cow stretch. This is a fantastic exercise for improving spinal mobility and relieving tension. Get on all fours, with your hands directly under your shoulders and your knees under your hips. As you inhale, drop your belly and arch your back, looking up toward the ceiling. This is the cow pose. As you exhale, round your spine, up toward the ceiling, tucking your chin to your chest. This is the cat pose. Continue flowing between these two positions, slowly and with your breath, for about 30 to 60 seconds. And finally, number 5 is the glute bridge. This exercise is excellent for strengthening your glutes and hamstrings, which are key muscles for supporting your lower back. Lie on your back with your knees bent and your feet hip-width apart, close enough that you can touch your heels with your fingertips. Squeeze your glutes and lift your hips off the floor until your body forms a straight line from your shoulders to your knees. Hold briefly at the top, then slowly lower your hips back down. Repeat this 10 to 15 times. Beyond exercises, a few lifestyle adjustments can make a huge difference in your recovery speed. Let's start with your sleep position. The best position is sleeping on your side with a pillow placed between your knees. This keeps your hips, pelvis, and spine in better alignment. Try to avoid sleeping on your stomach, as it can strain your neck and lower back. You can also use heat and ice therapy to manage pain and inflammation. For the first 48 hours after the pain starts, apply an ice pack to the area for 15 to 20 minutes at a time. This helps reduce inflammation and numb the sharp pain. After those first couple of days, you can switch to using a heating pad. Heat helps to relax tight muscles and improve circulation to the area, which promotes healing. Don't underestimate the power of an anti-inflammatory diet. Certain foods can help your body fight inflammation naturally. Try to include foods like turmeric, ginger, and fatty fish like salmon, which are rich in omega-3 fatty acids. Walnuts and flax seeds are also great choices. And as I mentioned before, drink plenty of water throughout the day. Your spinal discs are mostly water, and staying hydrated is essential for their health. To wrap things up, healing a slipped disc takes patience, consistency, and making smart choices every day. It's not an overnight fix, but by consistently performing these gentle exercises and adopting these lifestyle tips, you can significantly reduce your pain. Protect your spine from future injury and get back to living your life without being held back by pain. If this video helped you, please consider sharing it with a friend or family member who might be struggling with back pain. For more expert-backed health tips that you can trust, make sure to subscribe to Daily Health Support USA. Let's stay committed to building a healthier, pain-free life together. Thanks for watching.